All right, thank you so much for staying with us. Welcome back. You're watching Morning Cafe, and today is Thursday. That means you're talking matters health. This morning, we want to talk about the hormonal changes that occur during, or maybe before, during, and after pregnancy. And Dr. Ignatius Kibe, a gynecologist, is here, and he will guide us through the various hormonal shifts that occur during this period that we said during, before, during, and of course after pregnancy. Good morning, Dr.
Good morning.
Welcome back.
Thank you very much. Yeah, it's my pleasure.
All right, let's just get right into this. So what role do hormones play in preparing a woman's body for conception?
It's very unfortunate that in our part of the world, women do not prepare to become pregnant. It is by accident, it is during pleasure, is when they are doing other things and then they find her. Like currently, there are very many girls and women who became pregnant during the long holidays, last 2 months. It is very important, it's a very important question that you've asked me, because if they knew the hormones that prevail at every stage. If they knew what is follicle-stimulating hormone, which is the first hormone that predominantly helps the woman to go through her menses. And the follicle-stimulating hormone is the first hormone that also selects. You see, a lady like you, the way you are, the way if I were to assess you, I would say you have more than 1 million eggs. 500,000 on one side and 500,000 on the other side. How do you select which egg will be which will be developed to a baby? It's follicle-stimulating hormone. Is the one that does the selection. It is prompted by something called the pituitary gland, and there is another gland, hypothalamus, pituitary, and then they release the follicle-stimulating hormone. Basically, there are 4 hormones. So it will start menses. The first drop of blood, menstrual blood, will be provoked or will be started by the follicle-stimulating hormone. Then there is bleeding, which can take on average 3 days, 4 days, 5 days as the maximum. If a woman bleeds menstrually, the menstrual flow is more than 7 days, then we say there is a problem. If it is 3 days, that's okay. If it is again 1 day, again there is a problem. What is controlling all this? Follicle-stimulating hormone. Follicle-stimulating hormone after the 4th day tends to go down in the bloodstream. And what takes over is called estrogen. It's a pack of several, it's a team, estrogens. Estrogens proliferate, or they make the uterus to be ni kama kumwaga mbolea ili tupande rotuba, so that we may have a preparation for the uterus to receive an egg that has been fertilized. So there is the second hormone, that is estrogens. Usually, we use only one, we use the example of one hormone, estradiol, is the one that we measure in the blood, estrogens. Estrogens are pouring manure, like I said. They are increasing the fertility of the lady's uterus in preparation for a baby. Around the middle of the cycle, and that is day 13, 14, and 15, there is a surge of hormones called luteinizing hormone, LH. Luteinizing hormone. The LH, to use Guy's language, luteinizes or bursts the egg. It's now ready, so we have to release it for it to go and look for the sperm cell. So around day 13 and 14, we have luteinizing hormone. And this is the day, this day 13, 14, and 15. Start from day 12 for some girls. These hormones and the feelings are not the same for everybody every time. In fact, even in one person, they can vary. It's not on your marks, get set, everybody bleed. It's not like a standard.
Yeah.
Even in an individual, it can vary. This month, she bleeds for 3 days. Next month, she bleeds for 5 days. The other month, for 3 days. It's never exact. And the science is made up of exceptions. It's never cast on stone. So we have talked about luteinizing hormone, which will cause the bursting of the egg from the ovary into the fallopian tube, the fibria. These are finger-like projections that they suck the egg. That is day 13, 14, and 15. After day 15, an egg does not live for more than 24 hours. So the window for a woman to become pregnant is only 24 hours. If it's not fertilized, if there is no sperm cell, it dies and gets reabsorbed into the woman's body. Finally, if the woman got a fertilization, then there is a new hormone which comes up. It's called progesterone. Progesterone is the hormone that sustains this pregnancy. If there was no sex, for example, or there was no sperm to fertilize the egg, or there could be a sperm cell and also be an egg, but the woman is also having a family planning gadget or pill, then the egg is again not fertilized. So there is this last hormone is the progesterone. Progesterone. It is the one that sustains the pregnancy if she became pregnant, or once it is poured into the body, it goes around and tells the pituitary and the hypothalamus to meshika mimba. So there is no, for the next probably 40 weeks or 9 months, so to call it, the progesterone sustains the pregnancy, more particularly in the first month of pregnancy.
So you see, you said when you look at me, you can estimate the number of eggs that I have.
Yes.
Now my question is, does impact, or what impact does age have on hormonal loads and fertility?
Yes, what happens is that during the early premature years, a woman she has the ovules, but they are not yet fully developed to become eggs. And they could be as many as 2 million. They start reducing down. By the time a woman touches 51 years, note, 51 years, then there will be the menopausal syndrome. And the peak is around your age. You are approximately, according to me, this is an estimate, and I don't want you to embarrass you.
Okay.
Approximately 24 years.
Older, but okay.
You are slightly older than...
I'm older.
Then you have kept yourself very nicely.
Okay.
Around 24 years is the prime, is the climax of womanhood, is the most fertile time.
Yeah.
And you could be having anywhere from, at that time, from 600,000 to 1 million eggs. And they keep dropping, going down, 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 down. There reaches a time after age, approximately age 35,
Okay.
probably fertility rate has gone down by probably 35%. So the woman continues to become infertile as she grows old.
Okay.
And there reaches a time when we are doing this hormonal profile, we want to also check whether the hormones are there in good numbers. And we also check something called anti-Mullerian hormone, AMH,
Okay.
to see whether this woman has grown too old to deliver or to have active and mature and good eggs. I want you to imagine something like this. I want you to look at a pawpaw.
Okay.
For them to really understand us. Our pawpaw, before it is ripe, it has very many ovules, small, small seeds, but they are not mature, they are white, and they are not sweet, and they are not succulent. Haina maji, they are white, small ovules, eggs, which will eventually become seeds in the pawpaw. So the same thing with a woman, she, like, before 24, she has the eggs, which are not yet mature. And that's why I started by saying that they should know, because like currently, many women got pregnant without knowing during holidays, around Christmas, say from the beginning of December, when we had holidays like Independence Day and people enjoyed. Caroused, went out, Christmas came again, New Year. So there was a lot of love, and the whole air and whatever was happening is a lot of pleasure. It is now that they are knowing, oh, kumbe, nilishika mimba, and I don't want it. Or it was not from my boyfriend or my husband. Or it was from my husband or my boyfriend, but I was not, I'm not prepared. I'm not ready for it. That's what people call unwanted pregnancies. And that's why I said from the outset, as we started, women, you all should know these hormones. Of course, there are other hormones scattered all over the body that also participate in the fertility of a woman. But these four that I have mentioned, let me summarize them. FSH, follicle-stimulating hormone, estrogens, represented by estradiol, luteinizing hormone, and progesterone. These are the four that are key. But there are others.
How about the human chorionic gonadotropic?
Human chorionic gonadotrophin.
Yes, HCG.
Human chorionic gonadotrophin.
Right.
What happens is, after the woman has become pregnant, we now have to tell the body, hatutaki mimba ingine. Hujasikia mtu, you have not heard anybody saying, she'll deliver on February 10th and again deliver again in March 15th. No. The human chorionic gonadotrophin comes from the fetus on the 13th, 14th day of the embryo. There is the process now when the pregnancy is caught up, and we call it fertilization. There is a development of the shall we call it baby to ease the language?
Yes.
Embryo is called embryogenesis. Embryo is developing. It takes approximately 6 to 7 days for the embryo to move. We call it zygote, to move from the ovary and to drop into through the fallopian tube and to drop into the uterus, where it embeds or implants. Once it implants, it produces human chorionic gonadotrophin, saying we are now pregnant.
Yeah.
And probably for us who are Christians, we know that God starts now feeding the fetus, the embryo. Starts from 2 cells, 4 cells, 16 cells, continues like that until, like in you, there are trillions and trillions of cells. So this whole process I'm calling embryogenesis. Once there is implantation, then the body says we have human chorionic gonadotrophin, which says we are pregnant. Please don't bring any other disturbance and start feeding the baby in utero or the fetus. And that is the HCG, human chorionic gonadotrophin, that will make the woman start behaving funny. She's having morning sickness, she's feeling tired, she's feeling like she can vomit, emesis, she's feeling dizzy. She's feeling funny because she's pregnant and there are now 2 or 3, depending on how many developing fetus she's carrying. Yes.
All right. Now let's talk about how birth control influences reproductive hormones. Now that you brought it up, you talked about contraceptives. How long does it take for these hormones to stabilize after discontinuing contraceptives?
It is very difficult. This is one small area that is controversial, and I would like to guide ladies, because these people who promote family planning, sometimes they miss. They tell the lady that I'll give you a jab. For example, there is the 3-monthly injection for contraceptives. And they tell them, as soon as you stop, you'll become pregnant. Or sometimes it is the morning after pill, the so-called E-pill. And they tell them, as soon as you stop, you'll become pregnant. Or sometimes it is even a hormonal IUCD, intrauterine device. But it's not true. Sometimes a woman can take an E-pill and it messes the whole system. It messes the levels of the FSH, where we started, and the estrogens, and the luteinizing hormone, and the progesterone. It is never, you cannot say that the day you remove your for example, Norplant or any implant under the skin, and that the following month you become pregnant. No, it varies from person to person. Some people, it is total disorganization. Some people have stayed with the contraceptive device for years, and they have been told that the day you remove it, the following month, you'll become pregnant. No.
We've also had cases of people who remove it, but now they're having struggle conceiving.
Absolutely, that's what I'm telling you about. To get back the levels of FSH, estrogens, LH, and progesterone, it could take for as long as even 3-4 months, or some women even a year, before the hormones realign themselves and reach the levels.
Okay, just hold on to that. We have Esther from Nairobi on call. Esther, good morning. Talk to us.
Sasa shida nilikuwa nauliza.
Yes, Esther. Esther.
Nimekaa kama miezi 8. Kabla niweke kaka mtoto.
Okay.
Kanti ya.
Sasa nikifikiria niko na mimba.
Esther, we can't hear you. Come again, kindly.
Nasema hiyo miezi 8 sitatumia sindano.
Okay.
Ndio niko na mimba baba.
We can't hear her. We can't get her. Maybe we can bring her again. So Daktari Esther akitengeneza hiyo mambo yake, tunataka tuongelee hii maneno ya PCOS. PCOS. Some women struggle with such conditions. We're talking about PCOS, endometriosis. How do they impact hormonal function and fertility?
No, PCOS is polycystic ovarian syndrome.
Yeah.
And this has to do with, again, hormones. Like I said, there are the 4 hormones that I've talked about. But I added that there are several other hormones.
Yeah.
Like that is the issue of insulin. We have found that ladies who have a background of people who have insulin levels, insulin resistance, and people who have also used several times have used different family planning methods, sometimes misused.
Yeah.
Family planning methods without proper guidance. And that's why we said it is very important for them to understand. They can end up with the polycystic ovarian syndrome. What is a cyst?
Yeah.
A cyst is that egg. It started nicely, like we said, from your store of 1 million eggs, one was selected. It developed. It persisted to the 14th day, but it does not burst out. The follicle did not burst out to release the egg. So this fluid filled is like a blister that is fluid filled and has a nucleus. That is a cyst. If you do that, for example, if somebody swallowed a knee pill, an emergency pill, a morning after pill.
Yeah.
And therefore, the morning after pill, which is loaded with an amount of estrogens and the progesterones, refused the egg to be discharged from the follicle. That is a cyst. A cyst is an egg. It is maturing or is already mature, but it has not been discharged from the ovary. That is a cyst. When you do that in January, February, March, April, then they become many, we call them polycystic ovaries. And I said it is all hormonal. Sometimes hormonal imbalance, sometimes insulin, sometimes we have other hormones, for example, adrenaline, other hormones, for example, hormones that are right under our neck. There are very many interplays. So if there is an egg which matured but did not ovulate, did not get out of the ovary, that is a cyst. And when there are many, we call them polycysts. And we are saying that PCOS, there are certain drugs that can help.
Okay.
There are certain drugs, like there is a drug used for treatment of diabetes. And I said, insulin is involved in the formation of cysts. So there is a drug called metformin that is used by doctors. Don't try to buy it for yourself. Get a doctor to prescribe it.
All right.
But it helps in polycystic ovarian syndrome. And this polycystic ovarian syndrome has various, what you call symptomatology. Unapata huyu msichana, health yake, damu yake ya mwezi, it fluctuates. They will have irregular menses, sometimes no menses at all. Some of them get facial hair. Unaona msichana ako na
Devu.
madevu, kamoja ama tuwili ama mingi. Saa zingine anapata hata nywele za hapa chini. The pubic hair rises up to the navel or the umbilicus, and sometimes between the breasts. These are all signs and symptoms of polycystic ovarian syndrome. And sometimes they become anovulatory. They do not ovulate. There is confusion. There is hormonal imbalance. And it is now upon a good doctor to do a profile. Don't treat yourself for PCOS. I'm repeating it.
At what point do they now seek medical attention?
The minute you notice that your periods are not irregular anymore, or sometimes the volume of your bleeding, the volume of blood per menses. Some ladies get only a drop for one day. These are signs that there is something wrong with my hormones. Please go and see a doctor. And you don't buy drugs. And there is a tendency these days, some of us are using pills to treat PCOS.
Over-the-counter pills.
Over-the-counter pills. I disagree. I want a complete profile. We want to know which hormone is misbehaving, which one is low, which one is high, which one is affecting which. How is this whole scenario, how shall we make the hormones to be in proper concentrations? Because they are all graphical. So don't buy for yourself pills to re-regulate your menses or to re-regulate your hormones. No, let a doctor get involved.
All right. Now, what causes the emotional changes during pregnancies? Because you see, we talked about HCG, the human chorionic gonadotropic.
Trophic, yeah.
Trophic.
Human chorionic gonadotrophic.
I'll just say HCG.
HCG.
We talked about HCG, sometimes making a woman feel a little bit of fatigued. They have the urge to vomit. But now what causes the emotional changes? Because you see women sometimes, they have mood swings, but they don't really understand what is happening when they're pregnant.
No, the thing is, that's our very first sentence was, let pregnancy not be an accident. Let us prepare for it. Let us prepare the proper diet. Let us prepare emotionally. Let us, some ladies, and I pity ladies, especially young ladies like you, because it is, you are enjoying. Sometimes these days, you find is after a bash or during a holiday dancing or enjoyment. And a man, these days they even drug a woman. There are certain drugs that they place in your Coke or in your whatever, Fanta or whatever, your water. And you don't know even what is happening, and you find yourself 2 weeks later, I'm pregnant. Let pregnancy be something that is properly organized, so that even when the hormonal changes take place, the woman will be ready. Let it not be an accident, because there will be many things in play. One, when a girl becomes pregnant and she didn't know, or even when she went with a man, she was under the influence of dawa za kulevya. Hatajua. So what happens is that when she finally knows, and this is the season, you brought up this topic at the right time, because for all those who did it during holidays, this is the time they are noticing, last time I didn't get my period, now they are delayed. Then they are going for the human chorionic gonadotrophin test in urine. That is what we call pregnancy test. Doctors will write PDT, pregnancy diagnostic test. And many of them will opt for abortions. So that alone gives her an emotional jolt. she didn't expect to become pregnant.
Just hold on to that. I'll bring it up again. Wamboi is calling us from Kiambu. Wamboi, good morning.
Good morning.
Talk to us.
Yeah, I had a question kwa daktari.
Okay.
Ovarian cyst, is it treatable?
What is treatable?
Good morning.
Okay.
Yeah, I wanted to ask daktari,
Okay.
is ovarian cyst treatable?
Okay, she's asking if ovarian cyst is treatable. That is Wamboi from Kiambu.
Yes, there are very many approaches. One, like I mentioned, we can use drugs. Some of them, I said, are also used for treatment of diabetes type 2. And I mentioned even a name, metformin. But let a doctor do it. Sometimes we have something we call laparoscopy. When the cyst is big, I say the cyst is like a fluid filled, membranous, like a blister. So sometimes we just prick it with a needle, just like if you have a blister on your hand because you dug or you did something, you can prick it with a pin, isn't it? So similarly, there is a laparoscopy. A laparoscope is a small gadget which can prick. When there are many, when there are PCOSs, it's not one cyst, there are several cysts, it's sometimes worth slight, what you'll call minor surgical procedures, where we prick several of them.
Yeah.
So they are treatable, yes. But let it be done by a very qualified gynecologist or an obstetrician or at least a urologist, somebody who can have it guided or get a scan to guide him, and then he pricks them. So we can also use hormones to
Regulate.
No, to prick.
Okay.
Or to drain probably is a good word.
Okay.
The blisters that I'm talking about. I'm telling you, cysts, some people imagine cyst ni kama jiwe, apana. It's fluid filled vesicle. Unaona kama kamfuko ya kina mama, kamfuko ya kuweka pesa wale kina mama wanauza mboga, mama mboga. Hiyo kamfuko yao.
Yeah.
That is a very good illustration of a cyst. It's a small blister somewhere, and we said it results when the egg did not jump out of the follicle. Tuseme nini? Let us go back to the example of a pawpaw. That small, when the pawpaw is not ripe, that small ovule that is inside the pawpaw, white, that if that one doesn't finally become ripe and succulent, then that is a cyst. A cyst is an egg which did not jump out. Sometimes we get other types of cysts. Sometimes the shell that was the whole thing, the shell that was the follicle, finally becomes a corpus luteum. We call it corpus luteum. It's like the shell after chicken have hatched. Where does that shell go? That shell sometimes refuses to degenerate.
Okay.
So it becomes a corpus luteum cyst. So there are different types of cysts.
But it can be treated, right?
Oh, absolutely.
All right, we have Miriam from Ruiru. Miriam, good morning. Good morning, how are you?
I'm good.
Talk to us.
Nilikuwa na swali kwa daktari. Nilikuwa nauliza nimekuwa nini? Yakuwa nikipata mimba for 8 months.
Okay.
Then kuanzia November nikamit my period. November na December. Then on January, April 26th, my period came back.
Okay.
So what might be the problem?
She's saying she has trouble getting pregnant.
Yes.
Now she's asking what's the problem.
Now it's difficult for somebody to get pregnant. There are very many parameters. Least of them all is that is her husband himself fertile? The ladies, mind you, whereas you imagine that you are the one who has a problem, we have men looking very nice, very healthy, big beard these days. I see like it's a fashion to make a goatee and they look very masculine. But they have no sperms. They have no proper... Oh, the sperms are too little. So we have to do whether... We have to check the man also, to check whether he's azoospermic, ama akona nguvu za kiume za kutosha, ama sometimes you get a man, he has all the sperms, yes, but are they properly structured? Some of them do not have tails. Some of them have two heads. Some of them... So there are very many reasons why a woman may not become pregnant. Start with your husband. In fact, I encourage the boyfriends and the husbands to also be brought. And then, after that, after I've tested your husband or your boyfriend, whom you want to make you pregnant, then I'll go to you. I'll check the hormones. I'll teach the day of sex. And there we are very careful because we have some of them tell us, Daktari, if you can help me to get a baby boy. So we do that. We try. It's never 100%. Can I get a baby girl? We try. We do our best. So we test her. We also test to see that the uterus is proper. You just now mentioned endometriosis, endometritis, the ovarian cysts, PCOS. So we will test. We do various tests. We cannot say on camera, just here and now, what is causing the inability. And we don't say that you are infertile. Doctors sometimes say infertile. I like saying sub-fertile because sometimes you go and find out that these are PCOSs and we treat them. Sometimes you go and find that probably there was endometritis. Sometimes you go and find that there was a hormonal imbalance. Sometimes you go and find that there was a blocked fallopian tube. Sometimes you go and find there are so many different reasons, and on camera, and for only one lady in Iroiro, we cannot say why she's not becoming pregnant. Let her come and see us. Okay. Yes. So, and we shall order a few tests. We also don't work blankly. Okay. And I want to warn, especially pharmacists, this idea that there is a magic bullet. Ati wewe hupati mimba, ndio chukua hii Clomid, enda meza. Hapana. There is no magic bullet for pregnancy. Sometimes, like clomifene hiyo mnapeana, nyinyi watu wa pharmacy, somebody takes up to 10 of them. It is not proper. The clomifene citrate itself is hormonal and is going to influence hormones. And you should not take more than three doses. Now you find some doctors, some pharmacists think there is a drug, like a magic drug to make somebody pregnant. Don't do like that. Let us know why. Why is she not becoming pregnant? Okay. What are the reasons?
So should men also undergo hormonal assessments
Absolutely.
before planning for a baby?
Testosterone, we want to see whether the man has sufficient of testosterone, the hormone that makes a man, and that also assists in producing the sperm cell, a mature sperm cell. We want to also test in a man. We also want to test luteinizing hormone. We also want, these days, there are very many things because sometimes you find a man who also indulges in dawa za kulevya, ama alcoholism. Some of them do not have sufficient sperm cells. And sometimes we have the sperm cells, like I said, and they are morphologically not proper. They are not good. We also want to test the energy in the sperm cell, the fructose that the sperm cell will use in going through the journey to look for the egg. So there are very many parameters. And for a serious girl, don't go over the counter. If you want to become pregnant, first test about 10 different reasons why somebody does not conceive. Then we target the problem. But when you go swallowing maclomid, when you go swallowing pills,
it's making it worse, eh?
Yeah, you make it worse.
So you are telling us about the hormonal or the hormones that are causing these emotional changes, when mood swings on pregnant women.
Yes, one of them is of course progesterone.
Okay.
Others, there is a shift of other hormones in both men and women. There are hormones in the brain. For example, hormones that make your mood. Even now, as I speak to you, there are hormones that can flow into you. Hormones like hormones of pleasure. I don't want to. I don't want to make it complicated.
Is it adrenaline?
Yeah.
Is it adrenaline?
Oh, adrenaline participates, but I don't want to cause confusion because once I mention them, people go Googling. And when they Google and misuse them, I've seen a man who is trying to even precipitate anapatia msichana ili ampende. And it is possible. So I would be shy to mention them on air.
Okay.
Let them see a doctor, please. Because
mood swings are normal for pregnant women?
Yes, they are normal. They are okay. We are changing hormones, yes. And we are moving from the regular FSH, LH, and E2 and progesterone. You are moving now to progesterone as a dominant hormone. Okay.
So let's talk about after childbirth. You know, hormonal levels usually drop rapidly, and sometimes it leads to baby blues or postpartum depression. So what causes this?
Now what happens is, like we said, there are all types of hormones, and there are also all types of when a woman goes to get a baby, there is a lot of anxiety. That's where your adrenaline comes in.
Okay.
There are other hormones that are released apart from adrenaline, that are released by a woman to make the you see this area, the uterus and the birth canal, the V. I was telling you today morning, it's very difficult to do this program in the morning. You see, it is now there is a hormone called oxytocin, which will make the woman to relax. And the muscles and the bones to relax. There's even a hormone called relaxin. Look at the size of a woman's private part, the diameter, and look at the diameter of a baby. And it has to go through that, the head and the shoulders, especially this area of the baby, has to go through that narrow passage. And sometimes we even have to do an episiotomy. We have to cut the V of the woman at the bottom, the commissure. So there are very many changes in a woman as she delivers. And immediately thereafter, the body tries to go back to its original levels of the four hormones that we talked about. And there is also the diet aspect. What is she eating? Does she have sufficient of folates, methyl folate? Does she have sufficient of iron? Does she have sufficient? See, the baby grows very fast after the last trimester. And is growing from the mother. So a lot of calcium is depleted into the body, into the baby, the phosphorus. We have protein from milk of the mother. So all these changes affect the mother, yes.
Now causing this
childbirth.
postpartum depression.
Yes.
All right. For women who experience hair loss and skin changes, so what hormone causes these fluctuations?
Usually it is the protein. Look at this baby. The baby was 2.5 kilos. 3 kilos, okay. 3 kilos is of arithmetic. And within a year, it is 10 kilos. So where did these 7 kilos come from? From the mother. And some of it is in the, the baby is chubby and the cheeks are, and the baby has call it fat.
Okay.
The baby has a lot of fat. Where does it come from? From the mother. So it means that the protein in the baby is being derived from the food of the mother. And so you find sometimes the calcium, if she's not eating properly, the calcium in her bones, even some women, the calcium in her teeth get eroded and go to feed the baby.
Yeah.
The phosphorus from the woman, the protein that makes hair is protein. So the protein in the woman is pulled out through the breast milk, and that's why we say you people must be very careful with your mothers. Mothers are vital; they are very important. Because you find a woman loses a lot of herself to the baby. So in the first 1 year, and we say it must be exclusive breastfeeding, at least for the first 6 months. And you look at the baby, even the head and the neck were not stiff. And even the fraternal and the skull was not hard enough. It is the calcium from the woman in the form of carbonates, in the form of phosphates, in the form of lactates that has been deposited in the bones. So the woman's calcium levels fluctuate downwards. Like I said, many women in their 3rd trimester of pregnancy, and during breastfeeding, the woman loses a lot of minerals and proteins and the fats and virtually everything. You are making the baby through breastfeeding.
So is that why that's why some of these women, mothers rather, become so much hungry?
Absolutely.
And have a lot of mood swings when nursing?
Yes, because the minerals, I'll mention 3, 4, 5. I'll mention magnesium, I'll mention iron, I'll mention calcium, I'll mention probably the folates, which are the B complexes. I'll mention D3, the fat-soluble vitamins, A, D3, E, and K. They are all depleted from the woman, and they go to feed the child. So if there is like when iron goes through breast milk to the baby, when calcium goes, and if she's not eating properly, if she doesn't have sufficient of calcium, you find the woman craving. You find her eating soil in the 3rd trimester of pregnancy or immediately after childbirth. She's looking for these minerals. So there should be sufficient good nutrition in the 2nd and 3rd trimesters. Throughout the pregnancy, there should be proper nutrition. And that's why we started by saying pregnancy should never be an accident.
Should be planned.
Should be planned.
So after these pregnancies, do hormones completely reset? Or can previous pregnancies now influence hormone functions in subsequent pregnancies?
Absolutely. They have to reset. Some women, they reset within the first 2 months.
Okay.
And they can even become pregnant within the 3rd month of delivery. And that is why they are told to start again family planning.
Immediately.
In the 2nd I believe in the second month of
After giving birth?
after giving birth, it should be placed again on a good type of family planning method, so that again you don't interfere. There are some of the hormones which are coming out of the breast. Okay. We say they are teratogenic. There are some that can affect the baby prior to delivery, and some that can affect the baby during breastfeeding. So there should be a proper selection by a doctor on what type of family planning the woman should use post-delivery, postpartum.
All right. We have a question here for you. Hello, I have PCOS, but now have been treating it. It's not working. Where are you located?
Yes, currently we are building a hospital in Thika. I'll mention it. First of all, you can SMS me to 0722 534444, 0722 534444, 0722 534444.
All right. And we have a call in once again. Celestine from Nairobi, good morning. Cele? All right. We lost Cele. But I want to hear your final remarks as we close.
That's
our time is up.
So my final remarks is that ladies should be respected, and there should not be pregnancy by accident. And if anybody has a problem, let them see a proper doctor. Don't go taking everything, because like we mentioned, there are sometimes I've seen there is a big increase of deformed children and problems of pregnancy because of over-the-counter procurement and purchasing of drugs without proper professional advice. Please make sure that before, as you arrange to become pregnant, you start 5 months earlier. You plan yourself, you plan your economy, plan your family. Some women, when they are pregnant, that's when they have the biggest challenges of their lives. The in-laws, the husband, the community. So plan when you become pregnant and how you carry the first 40 weeks and the post. And you know, taking care of a baby is a Herculean, is a very big job. And it will be for 18 to 20 years. So be careful. Let pregnancy not be accidental. That is my final remark.
It should be planned. All right, that is Dr. Ignatius Kibe. Thank you so much for making time for us once again. We do appreciate your time. Tumesoma sana, and we hope we will stop now taking over-the-counter drugs. All right, thank you so much for watching. We are done with this conversation at this point, but up next is Fitness Thursday with Kim Keep Fit. We are doing lower body workout. Keep watching.